Which is the most significant risk factor for development of renal cancer? The right answer is option D, cigarette smoking. Which diagnostic tool is most commonly used to confirm hydrocephalus? The right answer is option D, CT scan. Which nerve is responsible for adductor muscle of thigh and skin of medial aspect of thigh? The right answer is option C, obturator nerve. In partograph, number of uterine contraction and duration of each contraction is charted in every option B, 30 minutes. The innermost layer of the gastrointestinal tract is named as. The right answer is option B, mucosa. When one kidney fails to develop, while other kidneys present with normal size, position and function, this congenital disease is called. The right option is option C, renal agenesis. What is the major amendment done under Penal Code Section 309 in Mental Health Care Act 29, 2018? The right option is option A, decriminalization of attempt suicide. The most common presenting symptoms of renal cell carcinoma is. The right answer is option C, hematuria. What expression should be observed on face while examining mental health of an uncooperative patient? The right answer is option D, placid. Drugs that relieve indigestion and heartburn neutralizing stomach acid are known as. The right option is option D, antacid. Which factor is most important when establishing disciplinary policies in a nursing institution? The right answer is option B, ensuring consistency and fairness. Which causative filaria agent displays a nocturnal periodicity? The right answer is option A, Brugia malai. How many kilocalories of energy are yielded by carbohydrates upon metabolism? The right answer is option B, 4 kilocalories. The recommended dietary allowance for folic acid during pregnancy is. The right answer is option C, 600 mcg. The condition when the membrane are ruptured before onset of labor is called. The right option is option D, premature rupture. Which of the following ear drop is used for the treatment of swimmer's ear? The right answer is option D, acetic acid. A patient with fracture of the pelvis should be monitored for. The right answer is option B, changes in urine output. A client with myocardial infarction develops rapid heart rate, difficulty breathing, and coughs up pink, frothy sputum. What lung sound would the nurse likely hear? The right answer is option D, crackles. The value and suitability of each constructed question items are evaluated through a specific method named as. The right answer is option D, item analysis. Which of the following is a normal finding during puerperium? The right answer is option A, mild transient urinary retention. What does etiology refers to? The right answer is option A, the cause of a disease. A person who harbors the microorganisms of a disease and excretes them without self-suffering from symptoms is called. The right answer is option A, carrier. In atherosclerosis, the fatty substance blocked and narrowed the coronary blood vessels. In which among the following layer of coronary blood vessels get blocked and narrowed by fatty substance in atherosclerosis? The right answer is option A, tunicum. Which reproductive option should be informed the parents in pediatric genetic counseling session for helping future decision making? The right answer is option C, pre-implantation genetic testing. Name the test employed to check the purity of butter through the estimation of volatile fatty acid is. The right answer is option B, Richard Missile number. In which phase of wound healing the wound appears pink and vascular? The right answer is option C, granulation phase. If a mother has gestational diabetes, there is a risk of development of fetal. The right answer is option B, macrosomia. Which reproductive option allow for genetic testing of embryos before implantation? The right answer is option B, in vitro fertilization with PGT. Lactose intolerance occurs due to deficiency of. The right answer is option C, lactate. Which of the following is a key strategy of the National Mental Health Program? The right answer is option C, decentralization of mental health services.